presentatie van dit event te mogen aankondigen. U gaat zo meteen een presentatie zien van Dr. Colin Brown, de Chief Clinical Information Officer van het University Hospitals of Morecambe Bay. En Colin neemt ons mee in een regionale samenwerking in een digitale omgeving voor coordinated care, gericht op patiënten die kanker hebben overwonnen. En het platform brengt deze patiënten en zorgverleners in verschillende zorgorganisaties samen. Dus zeker een boeiende presentatie en ik geef het woord over aan Colin in Engeland. Colin, the floor is yours.
Thank you very much indeed, and thanks very much for inviting me to share our experience in Morecambe Bay and in Lancashire and South Cumbria integrated care system, of our experience of how we're digitally empowering our citizens in general and our cancer survivors in particular. So thank you. Let me share my screen. And let me just take that into that. So hopefully you can see my slides.
Yep.
And I'm going to talk about empowering cancer survivors in their digitally integrated care in Northwest England. So thank you for the opportunity. So I've been a consultant physician and gastroenterologist for 25 years now. I've been a clinical lead for our electronic patient record system, which is Lorenzo, currently looked after by Daedalus now. And I've been a Chief Clinical Information Officer since April the 1st, 2013, and it's now my day 3000 today. So I'm pleased to share this with you. I've led on different things, including developing electronic patient records and content, how we share those records around our locality and wider. Been involved in developing population health tools and also patient flow digital command centres. And more recently, we've done some interesting things with virtual reality headsets, connecting care home residents with their GP remotely. So here's a visual as to where we are in the world. So on the left map, you can see in red, we occupy a small corner in the northwest. The cartoon in the middle shows Morecambe Bay in more detail, and we kind of wrap around a bay of water with the three major towns being Lancaster, Kendal and Barrow. Our population is around 350,000 and we cover about 1,000 square miles. However, we're one of four main localities that make up the much wider Lancashire and South Cumbria integrated care system, and that includes us in the north end, but it also includes Blackpool, Preston and Blackburn and Burnley, and that wider population is about 2 million. So just wanted to share that for some context. Our health service, the National Health Service, has generated business development strategies and also digital strategies to support those clinical service strategies. And in 2017, the NHS digital strategy had 5 main themes. And as you can see there, empowering the person, which I'm talking about mainly today, supporting the clinician, integrating services, managing the systems more effectively, and creating the future. And in 2018 and 2020, we developed our integrated care system strategy and our locality Morecambe Bay strategy, and they matched the framework and the structure and the 5 themes of the national strategy. So here we have a cartoon of our locality Morecambe Bay strategy, and top left we want to kind of provide the digital systems and the tools to make life easier for our clinicians, including providing the right information at the right time. At bottom left, we're looking to share our data along complex multi-organisation care pathways, and also between health and social care. Top right, we're looking to reimagine future clinical care and replan the way that we do things. And bottom right, we want to provide that seamless care with a better experience at lower operating costs. And in the middle and at the heart of this are our people, our citizens, and we're looking to empower our citizens so that they can make their choices about how they want to be looked after and choices about what services they wish to use. This is a cartoon representation of our digital ecosystem in Morecambe Bay, and central in the hospital is our Lorenzo electronic patient record system, and overall I would say that we're approximately 95% paper light now, and these are the different segments and areas that we support with that. But we're in a wider system, and top left we connect with primary care, our GP surgeries and our GP systems, and we've had direct digital links with primary care going back to 2011 now. All our GPs are on the same system, EMIS Web, which has been really helpful, and so we have those connections. The real advantage for us is that we've separated the data from our application, and we have all our data in a data warehouse with frequent feeds from the supply company, Daedalus, and because that data is within our control, we can move it around. So, for instance, bottom left we have a link with our locality IHE system, our local person records exchange service. It's an IHE platform, but we can share documents, results, and so on with that particular platform. Center left, we can share our PAS and process data with digital command centers. We've developed digital command centers to supervise and help manage our system and moving citizens around. If we look top right, we can link directly with social services through electronic digital referrals. Bottom right, we link with national systems such as the NHS Spine and the Child Protection Service. And middle right, we can link with our citizens directly with views of their care. That's what I want to focus on. But the principle here is that we've separated the data from the application, and we've got control, and we can move it around. In the progress that we've made in supporting our citizens so far is captured in these views here. So we were able to mobilize an app called My GP app, where our citizens could connect with GP practices and GP records and make appointments and order prescriptions. And so far we've got about nearly 100,000 of our adults in Morecambe Bay out of 350 onboarded in that system. What's developed over time and later is the NHS app, which has a pretty similar functionality now to My GP app, and looks pretty similar to the government digital services. So it's a similar look and feel if I want to reorder a passport, a driving license, do my tax, and I think that's pretty good. In 2018, we developed a maternity record, and we lost the paper record held by our mums. So we developed an app for our mums using in partnership with Microsoft using web SharePoint, and our mums can connect with their records and their care. And more recently, we've developed bespoke connections with our patients around appointments and appointment letters and booking. So this is where we've managed to see progress so far in linking with our citizens. So now what I'd like to do is kind of share our experience in the Morecambe Bay locality, and also in the wider Lancashire and South Cumbria integrated care system, in what we're doing to support our citizens, and particularly our citizens who are survivors of cancer. So here is a slide which depicts the increasing numbers over the last 10 years of patients who are living with cancer in the UK, and particularly these 3 tumour sites that we've been supporting in recent times. So those ladies surviving breast cancer, men surviving prostate cancer, and all sexes surviving colorectal cancer. We're seeing more survivors now, and this is due to a combination of better detection, better national screening programs, and better primary treatments. So we now have more citizens who are well, living normal lives, but have a previous diagnosis of cancer. So we've developed methods to try and support our citizens and those who are surviving with cancer. And what we're looking to provide is a better experience for our citizens. So when they're well, we don't want them to have to obligatorily attend hospitals. We don't want to disrupt life. We want them to lead good, full and non-interrupted lives where that can happen. We're looking for a better experience for our clinicians. So our clinicians in face-to-face clinics, we really want them to see patients who need to see them, and when we can add value to their clinical care. But we also are looking to support productive, efficient care. I mean, the UK, like many healthcare systems, is very challenged for healthcare staff. We are very short of doctors, and we're very short of nurses, and I'm sure this experience applies, across the modern world. So we're looking to provide better, more efficient services that are sustainable in the future. So if we're looking to provide stratified follow-up for our cancer survivors, how have we done this in the past? And we have done this in the past in the last few years, but we've used quite onerous ways of doing this. We've used paper systems, and the incumbent problem here is that the significant and great human effort that's required to manage cohorts of patients on paper systems and their fallibility. We've also used spreadsheets, and we all recognise the problems of version control and accuracy and so forth. And in recent times in Morecambe Bay, we've taken advantage of using the waiting list function in our Lorenzo electronic patient record, that for us is called access plans, but also using our bespoke business intelligence dashboards. We use Click as our business platform. And that's how we've looked after cohorts of patients. But we're looking to do it better. And in 2017, Lancashire and South Cumbria integrated care system, we actually made a strategic choice and chose Parsec as our partner for us to be able to build a safe and secure citizen record to support remote management of these citizens. So the web-based Vitally system from Parsec, it securely interoperates with our information health exchange, which we know as LPRES, or Local Person Records Exchange Service, but it's an IHE platform. And the Vitally system links with the LPRES system to provide our citizen record. the Vitaly system pulls in healthcare data from different sources around the integrated care system. So that's from different hospital bases, and it provides web-based support for our cancer support teams. It supports personalised care plans along evidence-based care pathways, which are embedded in the system. And it also provides a web-based app for citizens so that they can see their clinical care and their information, and they can be active partners in managing their healthcare. So this is a shot look at the system. It serves as a remote care patient platform, and it connects healthcare data records from different regional settings and different organisations, and it does so in a secure and interoperable manner. The system collects patient data from different sources and makes it available to all the cancer team members, and it does this through secure integration with the regional system and using single authentication using the NHS login for healthcare staff. Okay. So here's a view presented to the cancer support worker. The two key people in our cancer teams looking after these patients remotely are the cancer support worker and the clinical nurse specialist. And this is a view for the cancer support worker. So after the initial primary cancer treatment is documented, delivered and documented, so surgery, radiotherapy, chemotherapy. This is logged in the system, but then the key feature to be able to provide remote surveillance care is the embedding of an evidence-based care pathway in the digital system for each condition. And so there are disease-specific care pathways and templates which organise the future care. Here's another screenshot for the cancer support worker. And once patients are onboarded into the system on a particular care pathway, then afterwards personalised care plans can be co-created with our citizen to capture their personal choices, and questionnaires are filled in at intervals to capture their well-being or any emergent health concerns. And the clinical support worker can adjust the care plan based on the patient's health status. The clinical support worker can also raise red flags on the records that you can see in the middle on the left-hand side. So this red flag then is escalated to the clinical nurse specialist, who would contact the patient, provide a remote consultation, and either address any health concerns or provide any actions or escalations that are needed on the basis of new developments for the citizen and the patient. The clinical nurse specialist also has a role in promoting health and well-being for these groups of patients, and part of this is done through group sessions in the community rather than individual appointments, group sessions for cohorts of patients. So that gives some insight into how our healthcare staff can interact with the system and be supported in providing remote care. But the system also supports our citizens to be able to look at their care. So here are some views, or web app views that citizens can see, and these are accessible on smartphones or any tablet or PC device. And this system provides access for the citizen, for their contacts, their clinical teams, for any background information and educational materials, and also to their care plan and relevant activities to preserve their health and well-being. The app view also provides citizens with access 24/7 to their healthcare records, and this includes documentation, and test results. Clearly, this data is pulled out of source systems such as hospital electronic patient records. It's pulled out from the LPRES system, which takes the feed from EPR hospital systems. Patients can be reminded regarding planned future events, such as and they can be asked to do certain tasks. So at different times, they might be asked to fill in a questionnaire to capture any symptoms and quality of life data, such as healthcare needs assessments, patient feedback forms, and so on. This is the screens where our citizens can see reminders for any planned events or appointments such as surveillance tests. And clearly there are different forms of follow-up here. So, you know, a CT scan might be indicated in breast cancer, colonoscopy for bowel, mammograms for breast cancer, and so on. So, what do we see as the benefits? And for me, the key benefits here are for our citizens. You know, we want to support people living well lives, living independent lives, not being traditionally tied to hospital systems and not being traditionally tied to hospital visits, particularly when they're well. And here are some of the benefits for patients. That they can have confidence about their clinical care. They might not be face-to-face with a doctor most of the time, but they can have the confidence that their clinical service is keeping an eye on them. There's a reduced dependency on hospital visits. People don't need to take half a day off to go and see people in hospital, and sometimes that impacts on their own pay. It encourages booking of urgent appointment and supports urgent appointment booking when needed. And overall, it gives better satisfaction and reduced anxiety. And the feedback we've had so far from our citizens is they really like it. There are benefits for others as well. So our doctors and nurses feel happy and confident because they are being supported to provide safe and overviewed care. They're actually concentrating their time to be able to see people who really need to be seen face to face. And it really helps our doctors and nurses to manage caseloads and waiting times. For organisations and systems, there are reduced waiting times, reduced service costs, including for booking centres. And we're able to use our clinical resources better and more productively. So here's some data that we have from Morecambe Bay so far, and what you can see is there are around 300 new patients with cancer that have had their primary treatment each year that are suitable to be onboarded into this type of care. Now, depending on whether the service feels that 80% of these of future planned hospital visits over the next 5 years can be done remotely instead, or self-supported, or whether that level is 50%, gives a value for the number of traditional face-to-face clinic appointments we think we can avoid in Morecambe Bay. So, you know, for the different treatment groups, we're looking at a potential saving of nearly 16,000 appointments over 5 years for one service versus 5,500 in other services. So there is a significant benefit, and there is a goal in our NHS to reduce our face-to-face outpatient appointments by 30% overall, and this will help. The other thing that is worth remembering is that these are figures that apply to Morecambe Bay, but these figures can be increased fivefold in respect of Lancashire and South Cumbria wider integrated care system. So we're looking at one, supporting well lives, not dependent on hospital visits, but two, it really can free up the way that we provide healthcare. The progress that we've made so far is that we've onboarded a large number of patients with breast cancer around the ICS, over 2,000 so far. We are picking up the pace with the two other groups, colorectal cancer and prostate cancer, and it would be fair to say that our planned progress has been substantially hit by the COVID pandemic. But we are now rapidly onboarding colorectal and prostate cancer patients, and we aim to have achieved business as usual setting by March 2022. So that's only 9 months away. We have agreed that we will agree 3 more tumour sites by next year, and we will have operationalised one of these, with a further 5 more tumour sites being operationalised within 2 to 3 years. So that's the plan. But this is a real key to how we wish to redesign clinical care in Lancashire and South Cumbria. So for me, there are 2 things. Firstly, if you get new solutions where every party wins out of it, then that's a winner. It's like going to the circus and winning ducks at the coconut stall. So our citizens benefit, which is the most important thing. Our clinicians benefit, and our organisations and healthcare benefit. So everyone's a winner here. The other thing for me is that the important thing about digital is not, and we all know this. It's not the system. It's not the whiz bang, techie, gadgety things that really count. In order to get things done, we need good people working with good people and developing partnerships to create new futures. And that's where we deliver digital magic in my view. And I'd like to thank you. Thank you very much indeed.
Yeah, thank you very much, Colin, for these insights from the New Hampshire region. There are some questions, and I think we have some time for 1 or 2 questions. One is, how is the development of the apps and systems organized? Is it by NHS or by the hospital?
So I think the development of anything needs co-creation. So we have to have that kind of 3-way input, I think, from clinicians and the clinical teams. We need input from our IT departments in our hospitals, Morecambe Bay and the Lancashire and South Cumbria Integrated Care System, and we need to work hand in glove with the supplier and Parsec in this case. So it's 3 parties that need to get together to develop things.
Ik ben blijkbaar niet te verstaan. Okay, and then there's another question. You showed some figures which pointed out the values and the key benefits. So one question is, how are the local numbers holding up to the national numbers, and what are the key differences, if there are any?
So I don't know what the background is in Holland, but I think in England, what I would say is that we have a very uneven map of digital maturity around England. So for me, an absolute key for any provider organisation is that organisation has an electronic patient record system. That isn't the case at present. Some hospitals don't have EPR systems. On the other hand, there are a few hospitals that are living at a very high degree of digital maturity, HIMSS levels 6 and 7. There are some areas of the country where the way they do things isn't as well connected around a system, and then there are other areas that are very well connected around a system. And I think Lancashire and South Cumbria has been developing system thinking and system tools for quite a few years now. And so what I would say, I don't think there's an easy answer, but there are different developments and different achievements in different parts of the country. But I would say it's not even yet. There's a definite need to even out capability for doctors and nurses, but also our citizens around the country.
Okay, thank you. And then maybe to the last question, Colin, do patients have a choice in using it?
So I would say yes. If someone preferred not to use things, we would not wish to impose upon them. And I think actually what underpins that question is actually really important, because we do have to multi-channel the way we provide healthcare to suit the needs of all our citizens. So we'll have a lot of digitally smart and enlightened citizens who want to do this and want to do more. And actually, the pandemic has been a massive enabler in terms of opening eyes about what the internet can do and how we can go about our daily lives. However, there will be some of our citizens who just can't use tech, can't afford tech, don't have smartphones, and we have to recognise that we have to not digitally exclude people, but where possible, let's try and enable people to have easier lives.
Oh, great. Great. Thank you, Colin. Thank you for your presentation. Thank you for the insights from the UK. It was very enlightening, very inspiring, and hope to see you in person when this pandemic is over.
Yeah, we'll come and see Andre Ria. That'll be good.
Yeah. Okay. Let's make some music then. Thank you, Colin. Bye-bye.
Thanks ever so much. Thanks for the invite.
Bye-bye.